All right, good afternoon, everybody. Hope you had a great weekend. I'm here with Josh and Paul and Deirdre, Gifford, and Reggie. They, as you remember, led our vaccination advisory board, and we're going to be spending a little bit of time about how we prioritize vaccinations, now through the summer. And Beth buys, from early childhood, and they're going to be front and center in terms of some of our strategy if you have questions there. Very quickly, you can see the change since Friday. Still doing a lot of testing, 200,000 tests a week. The positivity rate stays very low, 2.6%. I think we're about 2.4% is the 7-day average. That's true around our region, around much of the country, so that's something we're positive about. Good capacity in our hospitals. Fatalities 39, that's over 3 days. That's a number that continues to trend down, but you probably saw the bone-chilling news that 500,000 have now died from COVID in the United States of America. The next chart, the vaccine update, a little more positive, get back on offense. We still are doing a very good job as a state compared to our peers in getting people vaccinated. 70% of the 75 and above have now been vaccinated, slowing down a little bit. 37% of those 65 to 74 have been vaccinated. Well over 800,000 total doses administered to date. A few small hiccups regarding weather, but we really have caught up there pretty well. And now that has us thinking about the next phase of eligibility. Spent a lot of time talking to fellow governors and looking around what's happening in the rest of the country. It's a bit of a jumble. As you remember, there's let's prioritize essential workers. Let's prioritize those with pre-existing conditions or more likely to have health-related issues. Philadelphia Inquirer, they sort of opened the door a lot to a lot of people, and it ended up being, quote, a chaotic free-for-all. WBUR, I think that's somewhere in Massachusetts. Do I qualify? Do I have a comorbidity? Vaccine confusion for patients with multiple serious conditions. Then when you broke it down by essential worker, who's an essential worker, who's not, here's a story from CNN about the SoulCycle instructor who was criticized for jumping the line. It was difficult to determine what your profession was as you're waiting in that long vaccination line, and some people jumped the line. And there's finally USA Today. Did the vaccine get overpromised? A lot of the process has turned, quote, chaotic and confusing. So far, we've done pretty well with focusing on congregate care settings, nursing homes, hospitals, 75 and above, 65 and above. And we're thinking about what we do next. So broadly speaking, these are our goals for vaccination. One, get as many people vaccinated as quickly as we can, especially those age-related who are much more likely to suffer complications and fatalities. Get the shots in the arm as fast as you can. And complement that with equity, knowing full well that our black and brown population here in this state and around the country are twice as likely to suffer complications from an infection, and half as likely to get infected, or half as likely to get vaccinated. A lot of reasons for that, but we're making a concerted effort to reach out to the underserved communities and make it easier for them to bring the vaccine to them, to make sure that they get vaccinated. That's important for their health and well-being, and that's important for our broader community's health and well-being. And as we tell you about where this leads us, I'm going to focus on the old business motto, KISS. Keep it simple, stupid. Because a lot of complications result from states that tried to finally slice the salami, and it got very complicated to administer. Here's some of the examples of problems that we've started running into as we tried to focus on essential workers and lists of comorbidities, some of which were appropriate and some of which were left out by the CDC. CDC said grocery and food service workers. All right, then we started getting calls. I'm not in a grocery, but I'm in a convenience store. It's a convenience store that serves, we have donuts, we have coffee, we have food. How about I'm a big box store, but I also have food? I think we should all be prioritized as well. I'm one of the folks that deliver from these stores and to these stores. I'm related to the stores. Shouldn't I be vaccinated as a priority group? And okay, I'm in the back office. I'm in the accounting team, but I am related to, say, a grocery store. So I think I should probably be vaccinated first off as well. And you can imagine if you looked at these type of questions for just the grocery and food service and extended that, we got a lot of the questions, and all my fellow governors were getting those same questions. Agricultural workers, all right, well, does that include landscapers? Does that include arborists? Manufacturing, okay, that's traditional manufacturing. Does that include construction? Does that include people that are making vaccines? Those are the type of questions we had, and it was very difficult, we found, talking to my fellow governors, to figure out actually what your essential employment was and how you self-identify, or was that just self-validated? Same issue on the other side. As you remember, the CDC said, let's focus on those with a high-risk medical condition. And then they gave us a list of some prevalent high-risk conditions. And then we started getting loads of questions as well. Well, I did have a condition. I haven't been treated recently, but I still think I have a condition. Shouldn't I get it? How come my precondition was not listed on the CDC list? And it was sort of shocking. I thought some of the conditions that were not listed by the CDC, asthma, HIV, type 1 diabetes, hypertension, folks with intellectual disabilities, all left off the list. And all the questions we had about what should be on the list, what should not. Do I need a doctor's note, or I just self-identify that I have diabetes? I don't have a doctor. Are those people left out if you require having a doctor's note? Those were all the complications we heard if you tried to define by this or that essential worker, or defined by this or that comorbidity. So I started thinking about what has worked so far. And we found, looking around Scandinavia, looking around Britain, and in our own experience, we found the close correlation between age and risk, age and comorbidities, and age and fatalities. I mean, I'm afraid you can see just from this chart that I think we've showed you many a time, 4,300 of a majority of our fatalities related to those over the age of 80. 20+% are those over the age of 70. And 96% are related to those over the age of 50. And then the numbers, obviously the risk goes down the further down the age chain you go. But I think you're going to see our beginning of our thinking that age is still a pretty key determinant in terms of risk. Age is a key determinant in terms of risk of fatalities, complications, hospitalizations, all the things we're desperately trying to avoid. So that led us to, this is our strategy going forward. We'd like to say, starting next Monday, March 1st, everybody over the age of 55 will now be eligible for the vaccine. Starting next Monday, March 1st, you can go to our online site. You can go to the CVS site. You can go to the Walgreens site. You can reach out, and we will start making reservations. We'll be cleaning up the 65 and above, but there will be vaccinations available next week for that community that's 55 and above. And Josh and Deirdre and Reg have worked really hard in terms of trying to get a better idea, looking out over the next few weeks and even few months, what is our supply of vaccine going to look like? We see, regular increases in our state allocations, big increases in what's going on to the pharmacies. J&J will probably be approved by the end of this week. It'll still take a month before it starts getting distributed, but that gives us a strong sense of confidence that if it's 55 and above starting March 1st, 45 and above starting March 22nd. That's 3 weeks later, and 35 and above starting April 12th. And then more broadly, the rest of the population, 16 and above, starting May 3rd. That's to give you a little bit of insight into how quickly we think we can get the broad scope of the population vaccinated. Obviously, it depends upon supply, depends a little bit upon weather. It depends upon whether 95% of that age cohort wants to get vaccinated or something closer to 70%. But I think it gives you a strong idea of how we think we can get you vaccinated on a prearranged schedule and do that efficiently. And do it in a way that if we end up getting more vaccinations quickly, we can ramp up. That said, there were a couple of other communities we wanted to pay special attention to. One is the folks that work in our schools. I'm so proud that Connecticut is one of the leaders in the country in having our schools open. I think the vast majority of our schools are open 4 days a week. And almost every single one is available, at least, with some in-person learning. And yet we do worry that occasionally folks who have been on the front line taking care of our kids. I think it's that important that we do everything we can to say thank you to that community that's been in the front lines keeping care of our kids and making sure our kids are educated and making sure we can keep our schools open as broadly as we can. That said, we're also well, let me just say one other thing about when it comes to schools, educators, and the such. And this is true of the broader population as well. This list doesn't have to include or shouldn't include those of you who aren't in the school building. If you can telecommute, you shouldn't be on this priority list. And I say that broadly to everybody because we've got a big scope when it comes to the 55 and above and all those involved in education. If you can telecommute, please don't make a call in that first week or two. Give us a little bit of time to catch up. If you've already tested positive and you probably have those antibodies, if that happened, say, in the last month or two, hold back. That gives us a little bit of extra time. Probably doesn't need to be said, but school board members, wait your turn. Maybe a lot of you are over 55, so it is your turn. And finally, I just want to leave you with the other group that is so important, and that's in the name of equity and making sure we go after those populations that have been left behind and most likely not to be able to sign up online or maybe drive through the Rentschler Field. That's going to be a special priority for us. Josh can tell you what we're doing in terms of the outreach there, working with the churches, working with the federally qualified health centers, getting our mobile vans right to the housing and where that might be, and why I think that's so important. A lot of these folks are multi-generational, so if your son or daughter is working in food service and grandma or grandpa happens to be there in the house, at least they've been vaccinated. So that's the way that we can help to keep them particularly safe as well. So this is going to be a priority for us in terms of outreach, getting the vaccine to these underserved populations. And Josh and Deirdre and Reg can tell you about how we're allocating some of the vaccines based upon need. So we're doing everything we can to make sure the people in the underserved populations are getting vaccinated at the same rate as everybody else. That's a lot to focus on right now. But again, I want you to know that, Reg and Deirdre, who've been on top of this, working with all the stakeholders, especially over the last weekend, working with all the healthcare providers as we tried to come up with a fair way to get this going forward. Beth By and her focus again on all the daycare providers, how important it is that we make sure they're at the front of the line. And of course, Josh and Paul to take your questions.
Channel 3 Eyewitness News.
Yes, Governor, you mentioned the difficulty of narrowing down that at-risk group, but for someone who is actually going through one of these health issues, no matter the age, will exceptions be made?
Well, I think I'll leave that to Reg and Deirdre, but I can tell you that we found that risk was highly correlated to age, and that it was very complicated to pick and choose amongst different exceptions there. But Deirdre, do you want to start with that?
Sure. Yes, Governor. I think the focus for individuals who have a chronic illness that are younger than 55 is that schedule that the governor showed, which is we want to give people the reassurance that it won't be too much longer for individuals to be able to start to access vaccine based on age. As the governor mentioned, most people over the age of 55 do have a chronic condition, and many of the chronic conditions on the CDC list are concentrated in older age groups, so we're catching the majority. As you point out, though, we understand that there are individuals with some of those chronic conditions who do want to get vaccinated, and that's why we're focusing on speed and simplicity, because we want to be able to get to people as quickly as possible.
Okay, so it's no exceptions being made right now, it seems like.
That's correct.
All right. And Governor, a question for you and your team. You know, this is the first time in my memory that you guys kind of broken from the CDC's recommendations. Was it daunting to do that? I mean, I'm sure that there had to be a lot of discussions going into this decision.
There were a lot of discussions going into this decision. The CDC gives you a little bit of cover. You can say, hey, we're just following the direction of the CDC, but it's not working. It's not working in terms of the lens was too broad. It was too badly ill-defined. It's leading to a great deal of confusion in other states. A lot fewer people are getting vaccinated because some make it so complicated. You got to bring a pay stub or proof of employment or a doctor's order. And we just said, this is the first time that we've decided to find a better way. And look, we're not blazing a new trail. Like I said, we've looked over in Europe. We've seen a great deal of success there. The healthcare professionals gave me a great deal of confidence that we are still prioritizing those most at risk. So I think it's the right way to go.
My final one, if I may, you know, I saw that it is a goal, but do you feel that schools will fully reopen at some point this school year?
Oh, I really do. I'd like to think that we're going to have the teachers and everybody else working in the schools vaccinated in less than a month. And I'd like to think that more and more of our schools can open 5 days a week. And I'd like to think more and more of the students will feel confident going back to school.
News 8.
How confident are you in the vaccine supply? Because we've been hearing July when Andy Slavic came on and said July probably for America. We're saying May. I'm
pretty confident. You know, Bill Lee and I have had a chance to talk to the CEOs of Moderna and Pfizer. We know that J&J is scheduled for approval. We'll see. At least they're going to make the determination, this week. We know that the Biden administration has doubled the order from both Pfizer and Moderna, and there could be a potential another 100 million coming from J&J. I'm not naive. I know there's supply chain issues. We'll see how fast they actually get delivered to us so we can get the shot in the arm. If I had to guess, though, right now, I think we're going to be erring on the side of more vaccines coming sooner.
And as far as teachers go, are they going to have their own stream where they can go to get vaccinated, or are they just in grouped with everybody else through the pharmacies?
No, they're going to have their own stream. Do you want to talk about that, Josh?
Sure. So we're going to be working with the superintendents and the local health directors. It's likely going to be a little bit different from town to town and district to district, depending on the size and scale that they have. But we do envision a model where there are dedicated clinics. And to be clear, again, it's not just teachers. It's everyone who needs to go to work either in the school building or who drives a school bus, as well as the professional childcare providers in those communities. So we're asking the local health directors and the superintendents to work together to come up with a strategy specific for that community to get those people vaccinated efficiently.
NBC Connecticut.
Hi, Governor. My question is about equity. We were just talking about that there. And, you know, when you're moving away from these frontline groups, there's a lot of people of color who work in those frontline groups. And now we're doing it by age group. So, you know, 90% of Connecticut teachers are white and only 10% are teachers of color. And then, you know, you've got a lot of frontline workers who work in transit and things like that. So how confident are you that this will help communities of color have better access to the vaccine when a lot of people who work in those frontline groups, grocery stores and things like that, probably won't have access to the vaccine until April 12th?
I'm going to tell you, we're going to work our heart out to make sure that everybody living in those underserved communities gets their shot. We're going to do everything we can to bring the vaccine to them, give them confidence, work with the ministers, make it available, readily available to get that done. But maybe, you know, Reg or Beth, you could talk a little bit about what else we're doing, and Beth can talk about the population that takes care of our kids in daycare.
Sure, Governor. I'll just say that certainly child care providers, about 45% in Connecticut are people of color, over 90% women. So this is a community that is deeply impacted and has been on the front line. It's a significant step that Governor Lamont is taking here for equity for child care providers, where in other states they've been left out of the education subgroup. So I'll let Reg speak to the rest, but this is definitely a step toward equity for these workers.
Yeah, and so I'm going to repeat sort of what the governor talked about, and that is sort of a separate track whereby a specific number of vaccines will be allocated for the communities that have high social vulnerability indices. So that alone, and remember the original track that we've been doing since we've had the vaccine will also be in existence. But here is an opportunity for, and thanks a lot for that, Governor, for us to, as providers, so all providers throughout the state, will then create a strategy. We're going to be having more conversation coming up in the few days around how we make sure that we do our part to listen to, partner with, and make it easy for those vulnerable populations to have access to the vaccine. And that may very well mean that we take the vaccines to them. And that's a lot of what's happening throughout the state as well. So I think that this is the right way to address the vulnerabilities that exist throughout the state. It also affords us the opportunity to have a more targeted or strategic approach around addressing hesitancy. So where we need to spend a little more time on focusing on areas and giving them more information around the quality, safety, and efficacy of the vaccine, this organizes, I think, that approach so that we can communicate better with such populations.
If I could add just one other element to this, the governor has asked the Department of Public Health to work on actual numeric targets for these high vulnerability communities. So as Dr. Eady alluded to, we will be setting a target and rolling that out with our vaccine providers and measuring against that on a week-by-week basis to see if they're reaching their targets of administering vaccine to people who live in these high vulnerability communities.
Fox 61.
Hi, Governor. Josh, I know you talked a little bit about this already, but going back to specific plans in March regarding getting teachers and staff vaccinated, is there any specific dates you could share in terms of when we could see clinics dedicated for them specifically up and running throughout the state?
Sure. Yes. So as the governor mentioned, those clinics will run during the month of March. So you'll start to see some as soon as next week. And then you'll see them progress all the way through the end of the month. So there's an element of patience here that we also, as always, whenever we open up a new phase, we have to always ask for patience for the people who are newly eligible. And certainly there will be some clinics that go into the last week of March as well. And so we just ask for some patience as we work with our districts to get those scheduled and ensure we have everything up and running.
Then is there any update on loosening up travel restrictions?
We're going to be discussing that this week. We're still reaching out to our fellow governors on that.
News 12 Connecticut. WTIC 1080 News.
What are the specifics on teachers and school staff? In one reading of this, they start March 1st. Another reading is that it's going to be spread out through March.
We can't do every school on March 1st, that's for sure. But Josh and Deirdre reached out to all the superintendents, I think it was today, told them to start preparing so we can get the mobile vans into these schools. We'll see who's getting ready to get going first, and we're going to be able to start within a week or so.
And last week, essential workers included teachers, and correct me if I'm wrong. Now it sounds like there's a group of teachers going with staff, but the essential workers are not in for now. Does that sound right? The other essential workers.
Certainly, it's everybody who works at the school, including the teachers, the para, and everybody else that we talked about. As regards other essential workers, it's 55 and above, and then you can see a date certain when it's 45 and above.
And Governor, you followed Governor Cuomo pretty closely through this process. Given the nursing home death undercount in New York, have you lost confidence in the governor?
No.
Connecticut Public Media.
Good afternoon. Was this decision taken without the input of the vaccine allocation subcommittee?
Reg, Deirdre?
Yeah, so I'll go first, and please add to it, Commissioner. So, in fact, going by age was a recommendation that came from the allocation subcommittee. So we talked about that for a while, and having conversations with the governor, we think that this is the right way to go. Also, the allocation subcommittee, its leadership, so Zita and Nichelle, were asking that we consider a separate track for those high vulnerable communities. And so just as they asked, it has now come to fruition. So, and they're well aware of this and have participated over the weekend in some of the many conversations that we had to get to this point. Commissioner?
No, nothing to add, Reggie. The chairs were consulted and were very involved in this process.
And what about people who are contracted to work in hospitals from outside companies? Will they have to wait for their age group? You just said there's no exemption, so I'm assuming that they'll have to wait until it is their age group.
Well, if they're working in patient-facing healthcare, they qualified under 1A. If they're not exposed to materials or to patients, then they would go by their age group. You're correct.
Thank you.
The Associated Press.
Thank you, Max. Are you guys ruling out, good afternoon, by the way, are you ruling out the possibility that there could be maybe some more special clinics? Say there's a group of people that may have pre-existing conditions that are at greater risk than others?
Right now, Sue, I think it's pretty tough to narrow each of these different cohorts and determine what's more serious than something else. But we can take a look at things if situations change.
And what does this change mean for someone that may have already been contacted by their physician? They may have already been put on a waiting list for Hartford Healthcare or one of the other providers, and they may be a little bit younger than the next group.
I'm not sure how much of that has happened. Maybe Reg can speak to that. I can tell you, though, I've heard from plenty of doctors who said, thank you. My phone was ringing. People wanted me to pick and choose, this type of condition versus another. That was an impossible situation for us to be in. This is a cleaner way for us to do it. But, Reg, do you want to add to that?
Sure. Listen, I'll say the commissioner has been very, very clear in her messaging, and from an accountability perspective, technically we should not have been doing that, if I understood the comment or question correctly. So we're following the recommendations coming from the governor's office to a T, and without exception, unless we're allowed an exception to move by. So that's the case. That's where we are. Today's decision, the governor's announcement, should not negatively impact anything that we've done prior to today, to my knowledge. So I think things will fall into place, and I don't think that will be an issue.
Okay. And what will happen to vaccine providers if they don't meet these numerical targets for racial equity? Are there any consequences?
I can take that one. So, you know, we are still working through what the exact protocol will be, but we've been meeting with these providers. They're very enthusiastic about making this commitment. And I think what the first thing that will happen is we're going to measure this by provider. And so we'll know, and they will know whether they're meeting the targets. And like I said, in talking to our largest vaccine providers, they are enthusiastically supportive of this kind of a targeted strategy. They asked actually that we bring them together on a periodic basis so that they can share the best practices about how outreach to these high-risk communities is working, what kind of resources are needed, who's having success, and how they're having success. So we will measure, and then if a provider isn't meeting the targets, we'll need to work with that provider to make sure that they are using the best practices that have been surfaced. And then we'll talk further about what happens if they still aren't able to meet the targets that we set.
Okay, great. Thank you, everyone.
The CT Examiner.
You already answered my question. Thanks, Governor.
The Day of New London.
Hello. I wonder if you have data, ballpark numbers on how many people are in these age groups, and also how many were you anticipating would have been in the underlying conditions cohort, if you will?
Sure. You want me to take that one,
Sure.
Governor? So absolutely. So as we look across the next phases here between the folks 55 and above who have not already been vaccinated, keep in mind some people who are 55 to 64 have already been vaccinated as a function of the fact that they work in a hospital or a staff or resident at a nursing home, et cetera, as well as the educators and child care providers. You know, we estimate that to be about 650,000 or so when you deduplicate across the categories. And we go from there, it's about another 400,000 for the 45 plus and the 35 plus. So that's how we've kind of mapped it out, looking at the number of people eligible in each phase and the expected number of doses we should be getting, and calibrating that accordingly.
So it's 650 in the 55 to 64 range, then 400,000 in each of the 45 to 54 and 35 to 44 groups?
Yeah, estimated. And keep in mind that these phases don't begin and end cleanly. They feather in across each other as appointments. Like for now, we have, you know, appointments of people who are 65 and above, you know, largely booked up through next week into the following weeks. And those appointments obviously will be kept. And as new inventory comes available for appointments in the coming weeks, that's what we'll fill.
And the remaining people with underlying conditions who haven't been vaccinated to this point, you know, roughly how many, were you estimating how many that would have been?
I understand your question correctly. I don't think so. I mean, I think the governor made the point early. We do know that people with underlying conditions overwhelmingly skew into the older age categories, and we believe that, you know, with 55 and above, we'll pick up the vast majority of those people.
Mm-hmm. I think one last thing is it seems like this is really accelerating things, because previously we were hearing that, you know, the last groups would be getting vaccinations in the summer. Now we're in, you know, the start of May. So how do you account for that? How are you able to accelerate it, or am I not thinking about it right?
Yeah, as the governor said, we've been getting progressively better news out of the federal government, both in terms of, you know, confidence in our state allocation that we've been receiving that's been increased every single week over the last month. The federal pharmacy program, which is doubling this week in terms of the number of doses that are coming into Connecticut, which will open up a lot of additional appointments in our pharmacy partners towards the end of this week. the new federal program delivering doses directly to some of the federally qualified health centers. That's new supply, as well as the governor mentioned, optimism around the Johnson & Johnson vaccine, hopefully receiving EUA approval from the FDA potentially this weekend. So all of those things come together, as well as the governor's discussions with some of the manufacturers, would give us optimism that things are going to pick up.
Thank you.
The Connecticut Mirror.
Hey, everyone. If I could go back to a question that was asked earlier, could you talk or elaborate more on how much input the vaccine advisory panel had on this decision? And also, given that we've laid out the parameters for the remainder of the rollout, is the allocation subcommittee's work or the larger body's work considered concluded at this time?
Deirdre, Reg?
You know, I'll probably repeat myself from the previous question. Commissioner, is there anything else you want to add to that?
Yeah, I would just say you have the co-chair before you of the advisory group, and he's been involved. We have been working closely with our chairs on a variety of issues, who have in turn been consulting with the members of their various subcommittees. So I think there's been lots of consultation back and forth with the advisory group.
And could you talk about how many clinics will be set up for teachers and childcare staff, as well as how many people are in that bucket of folks?
Sure. So we're working through the details now on how many specific clinics will be necessary. As you could imagine, in some of the larger cities, there could be clinics that are dedicated just for a particular school building or for a district. In some of the more rural parts of the state, we'll probably see some teamwork across multiple towns or multiple districts to do clinics together to get critical mass. So those details are being worked out right now, and we'll have more to share in the coming week or so. In terms of the numbers of all of the educators, including the teachers, the custodial staff, the food services workers, the bus drivers, and the others who have to come to work in the school building, as well as the child care providers, we estimate that that's about 160,000 people in total. And again, with all of these numbers, remember that not everyone is ready at this point in time to step forward and get a vaccine. So we also factor that in as we plan out the timelines here.
And will the folks among the school staff be required to attend the special clinics, or can they also sign up to go through a provider or somebody else?
Yeah, it's a great question. We're hoping that most people will take the opportunity to participate in their dedicated clinic. We're going to make that very easy for them in terms of, in many cases, it'll probably be in the school building itself. And we're hoping that people will be patient and take guidance from their superintendent or their community about what those opportunities might look like, and that we can use those as an opportunity to take pressure off some of the mass vaccination sites and other vaccination sites that will be available for the rest of the population.
Thank you.
The Hartford Current.
Hey everybody, this is Emily Brindley from The Current. The first thing that I wanted to ask about is about the carve out for educators. Could you, Governor, speak a bit to why educators are the only carve out, and why they aren't, I guess, prioritized at the same level as people who are also frontline essential workers, such as grocery store workers and restaurant workers? Do you believe that teachers are at a higher risk?
I believe it's that important that we keep our schools open and get them open full time for our kids. We've lost, some kids have lost a lot of education over the course of this year, and I want to give them every chance we can to catch up. We have a few more months left in this school year. I saw that a lot of our schools, some of our schools were losing time to quarantine because of testing, positive tests. So I thought this is our opportunity to make sure that people in our schools are not only tested but vaccinated, and that'll make sure our schools can stay open. I thought the same thing when it came to the daycare, by the way, Emily. Daycare providers were there from the very beginning, the child care providers, right there during the peak of the pandemic. I know how absolutely important that is for those kids and for those families, for mom and dad who maybe have to go out and get to work. So I thought it was that big a priority.
And I don't think anybody would argue that teachers are obviously crucial, but I also don't think that answers the question, why teachers and no one else? Are teachers at higher risk than grocery store workers?
Well, when you say, no one else, I had to narrow the lens, or else that's what's happened around the rest of the country. They just said first come, first serve. I thought it was very important for us to prioritize 55 and over because of the risk, as you heard, and then prioritize, educators and daycare, and then the most vulnerable populations. We couldn't do everybody at the same time.
I think another important point specific to this topic, Emily, is that, once you've been vaccinated, if you have exposure to someone who's tested positive, you don't have to quarantine anymore. And the issue has not been that there's been a lot of people getting COVID in our schools. It's that a lot of teachers and other professionals in the schools have had to quarantine because of exposures. And that's forced a lot of shutdowns, temporary shutdowns of schools, that if we want to keep schools open and get more schools open fully between now and the end of the year, we can avoid that by getting people vaccinated. And keep in mind as well that this is a unique environment where it's not just about the employees, but it's also about the students. And there have been tremendous impacts on students now. All of us who have kids see it every day with the Zoom learning and the impacts. And there's a real equity component to this as well, because we know a lot of the students who've been most impacted by schools that are closed are a lot of students in some of our cities. And so making extra effort to get the schools open, and this is a key tool for that, we think will have meaningful impacts on the children as well, which is a critical consideration here.
And what would you guys say to the frontline essential workers who are not educators and the people with underlying health conditions who are not older, who have been expecting to get vaccinated pretty soon and, are now seeing the news today that they may have to wait months?
So I can offer the following, which is, first of all, we understand that some people will have to wait a few more weeks. In most cases, it won't be months, and I would encourage people who were in one of those categories or have a chronic condition to look at the calendar and see where they are slotted in to our proposed strategy. The other thing to keep in mind, which I think we haven't maybe focused on quite as much, is that the group, as we looked at these lists, was getting so large that many people in that group would have ended up waiting for their vaccine, potentially even longer than they'll end up waiting now. And some of the most high-risk individuals, because of their age, would have been pushed until later in the phase. So we were going to end up needing to stratify this group, as the governor said, in some way, because it had gotten so large, because of the very valid number of people who were saying, what about my condition? What about my industry? What about my job? And so this actually just makes it very clear for individuals in those categories. They can look at that calendar and say, okay, now I can see about when I'm likely to be able to get vaccinated.
And one last question for you, Governor. When you formed the vaccine advisory group back in October, you pledged that the group would follow a transparent process, a publicly available process in making vaccine decisions. And this announcement now has almost entirely sidestepped the group, certainly sidestepped their public meetings. And residents haven't had a chance to weigh in on this before it's just been announced. So do you feel that you've upheld your pledge to make this a transparent process?
Well, I'm certainly here taking every question I can. So's the two co-chairmen of the Vaccine Advisory Board and others, Emily, trying to tell you exactly the decisions we made and the decisions we changed and why we made those decisions, why I think it's in the best interest of the public health for each and every one of us here in the state of Connecticut. And here to take those questions and answer them as best I can.
Just to clarify, though, your transparency pledge was not only about answering questions after you made decisions, it was also about taking residents' feedback during the process of making those decisions. Do you feel that residents have been heard during this process?
Well, I'll start. I mean, one of the reasons we looked at the CDC guidelines and decided what we did was because we got a lot of feedback from residents. But maybe the two co-chairmen would like to say, how was their public input as regards your decision making?
Yeah, so a lot of what we're seeing in today's proposed strategy actually came from conversations, if you go back and look at the tapes, from the allocation subcommittee, which they got feedback from the community. In addition to that, input was provided by some of the leaders at different healthcare systems or providers throughout the state. And so putting all that together and understanding the best way to live up to catalyzing or getting as many residents inoculated or vaccinated as possible, this was the best way to approach it. And also, from an equity perspective, again, recommendations came from the community to these allocation subcommittee, and you're now seeing that come to fruition in this current strategy. So, I mean, I'm comfortable that we have well represented the opinions of people in the community as best we could. There's no perfect answer, but I think this is going to end up being a best practice throughout the country because of the speed in which we're able to get to the groups. Had we, I believe, had we maintained the direction we were going in, we will be talking about, probably June, July, I think, and I don't remember the calculations, but this is the fastest way to get as many residents in the state of Connecticut vaccinated as possible.
Thank you, everyone.
CT News Junkie.
Thanks, Max. Is there any reason that the Vaccine Advisory Committee should still exist then? Is there a reason for them to continue to meet?
Well, I'll start. I mean, I think so. We're continuing to make decisions, and we continue to need feedback. And we've made some decisions now. We've got our timeline as best we can, Christine. But, situations could change. And at that point, having an advisory board made up of stakeholders in the healthcare community and our other different communities is going to be invaluable for the feedback.
So the decision in order to prioritize age over the essential workers and that people with pre-existing conditions would have to fall into the age category, there was no way to set up any sort of, like you're doing with the teachers, no way to set up any sort of special clinic for those with pre-existing conditions?
I didn't think so, Christine, because there was a list of pre-existing conditions that included almost half the state. And it left off a lot of really key pre-existing conditions, and we found it really complicated. Talking to healthcare providers across the state, Deirdre did that said, look, we cannot prioritize amongst these 800,000 people. It's just too complicated right now. We think age is probably the easiest way to make that decision and probably the most health-conscious way to do it.
And as a parent, I'm curious if there's going to be disaggregated data about how many teachers received the COVID-19 vaccine in each school. I currently know how many children in my daughter's school have a religious exemption. Will I know how many teachers are vaccinated?
Josh, do you know that?
No, I don't. I don't think we've gotten that far yet.
Okay, let me know. Thanks.
Hearst, Connecticut Media.
Thanks, Max. Hi, Governor. Hey, Josh. I think the adjective last month to describe VAMS was clunky. Has it gotten any less clunky?
Hey, Ken. Yes. Actually, every week the federal team that is responsible for that program is taking feedback from states and adding features and helping to enhance it. But also in Connecticut, we've been doing work in and around VAMS to give people additional options that might be better for some or easier for some to get access. And so just as a couple of examples, everyone knows, I think at this point, that you don't have to go through VAMS. You can call our toll-free phone number through the United Way 211 line and get booked in appointments directly there. A number of our major providers, including Harvard Healthcare, Yale New Haven, and others, are booking appointments directly. The federal pharmacy programs, CVS, Walgreens, Walmart, they're booking directly. And a number of our providers, including local health departments, federally qualified health centers are doing a lot of really creative work in the communities, doing specific outreach to targeted communities, outbound phone calling, reverse 911 calls, community organizing to get people out to get vaccinated, and directly enrolling them into slots. So there's a lot of great work going on out there. We are looking at additional opportunities that we can provide in addition to the map that already exists to make it even easier and clearer for people to identify where locations are near them that may have appointments available in the near future. And so we'll have some new announcements there in the next several days. But it is getting better every day, and I think as people get used to it and the other options are available, we'll see less frustration there.
And one thing to add is that there's no wait today at our appointment line, the Vaccine Access Assist line. So if you are 65 or older, or if you're a healthcare worker and you haven't gotten your vaccine yet, your appointment, you can call the Vaccine Access Assist line today to schedule your appointment without a wait time. There'll be somebody there to take your call and help you get scheduled for an appointment. So really want to encourage everybody who's 65 or older or in one of our other categories that hasn't had a chance to schedule their appointment yet to give that line a call or reach out to one of our other providers or to a pharmacy and get your appointment scheduled.
Thanks, Dr. Gifford. And Josh, how many doses did we get last week? How many are we getting this week, and how many next week, if you know any kind of ballpark number?
Yeah, there's a lot of good news there, actually, Ken. And the governor mentioned some of it, I think, last Thursday. But our state allocation is going up from what we received last week to this week, from 59,000 to 72,000 doses. And then on top of that 72,000 doses, the federal pharmacy program has doubled to 23,000 doses on top. So we're at about 95,000. That's just first doses that will be available this week. That's going to continue on going forward. So that's kind of what I was alluding to earlier when I was talking about the good momentum in the supply coming into the state right now.
And that's what I get for missing last Thursday's news conference. Thank you.
The Waterbury Republican American.
Thanks, Max. Is there going to be, well, first of all, how much more vaccine is going to high SBI communities in terms of dosages or percentage?
I don't think that number has been determined at this point, but conversations will continue, I think, within the next 24 to 48 hours. And I don't want to speak out of turn to Commissioner or Josh, but I don't think that has been determined.
So the point is that we are not only allocating doses to providers operating in those communities, which we have been doing from the beginning to make sure that providers who are operating in those communities have plenty of vaccine supply. But this additional step that the governor is talking about and the numerical target is to say to our vaccine providers, not only do we want to see you operating in those communities, we want to see the doses going to individuals who live in those communities. And those are two different things. So this is an additional step beyond saying you're going to have adequate allocation. Say we'd like you to focus on making sure that the doses you're giving are to people in those communities in proportion to the population percentage that they represent.
Okay, so then there'll be sort of specific targets then tied to the population figures, right? Is that what you just said?
That's right.
Okay. Well, thank you. In terms of the school clinics, will school districts in high SBI communities get priority over their other school districts in the state in terms of distribution?
Yeah, like I mentioned earlier, Paul, we're working through the implementation of that, over the course of the next week. And so, we'll have more to share either Thursday or into next Monday.
Okay, what are the limitations going to be on school volunteers so that we don't have a situation where a school board member spouse or a school administrator's spouse suddenly signs up to be a volunteer?
Yeah. So good question. Something we've talked about. To be clear, people who have been volunteering in the school building, in classrooms, and there are many people in that category, would be eligible. We do not expect or want to see surges in numbers of volunteers opportunistically here as a result of this. And again, we don't expect to. I think, there's been some public examples learned by people who have not followed the instructions carefully here. And candidly, a lot of these people, as Commissioner mentioned earlier, are going to be eligible anyway in the not too distant future. And so, because of the timelines we've laid out, hopefully people can see where they're coming. And for everybody out there, we're not going to have to wait that much longer before all of us, have access to vaccine.
And once fully vaccinated, will all teachers be required to return to the classroom to teach in person?
Well, the employee-employer relationship exists at the municipal level, so we defer questions, I think, to our superintendents in terms of how they'd like to move forward, as we have done throughout the pandemic.
Okay. And Governor, earlier you said you have confidence in New York Governor Andrew Cuomo. You both handle the reporting of nursing home deaths differently. Do you think that New York State was wrong not to have included nursing home residents who died in the hospital in terms of the overall counts for nursing home?
Yeah, Paul, I can tell you that I think 50 states and 50 governors defined nursing home related COVID fatality different ways. Some states, if they had flu-like symptoms in the nursing home and then they passed away either at a hospital or at home, was that a nursing home related fatality or not? Every state had a different way of doing it. We erred, for better or for worse, by saying if you had those type of symptoms and you died of, we called it a COVID-related fatality. If it was at the nursing home, if it was at the hospital or home, we called it a nursing home related, we called it a COVID-related fatality at the nursing home. But Paul, every state was doing it their own way. It's, it will be sorted out over time. If I could just say in conclusion, because it's getting a little late here, Deirdre just reminded us, hey, folks 65 and over, speak now or forever hold your peace. You can make the call. You can make appointments. There are available appointments this week and next week, and I would do it. I think you're going to find starting Monday, when we open it up to 55 and above, it's going to start getting crowded. We're opening it up to a pretty big cohort. It's about, as you heard, Josh say, about 650,000 people, 150 in and around the schools and 555 and above. That's big. And our other groups, 65 and above, 75 and above, it was a much smaller group, about half that size. We're doing that purposefully. We think we got more vaccines. We got the capability to support it. But I would urge you to be patient. I've seen websites crashing and phones busy for hours in other parts of the country. We tried to narrow the cohort, make it easier for you to, make that appointment, but it's still going to be busy, especially that first week or so. Again, if you can telecommute, if you've maybe tested positive recently, maybe wait your turn a little bit longer and let those that are a little more pressing get to the front of that line. But I think it's going to be a really key couple of weeks. I think we're turning the corner on this, and if those vaccines come in the way we hope they will, it's going to be a pretty nice late spring, summer in this state. Thanks, everybody.